Hi everyone, this is Dr. Devin Barley with Greenwich Chiropractic, and in this video series we're talking a lot about SI joint pain or dysfunction, or sacroiliac joint dysfunction. And we know that this plagues a lot of people out there. If you're runners, if you're active, if you have arthritis in that SI joint, there's many different causes for SI joint dysfunction, but when it happens, you absolutely know. And the number one reason why people know that the SI joint dysfunction happens so often is that it's a really large joint. So when we look at the anatomy of the SI joint, basically S stands for sacrum, that is this big bone kind of in the middle of your spine, the base of your spine, and I, the ilium, is the part of the pelvis that articulates with the spine. And so when we look at the spine as it moves as a whole, using the SI joint, you're going to kind of go through this figure eight motion. What happens over time is you can get a misalignment or a fixation in here, adhesions build up, and you lose that range of motion in the SI joint. When that range of motion is lost over time, it can even change your gait. So if you're a high performance runner, what does that do for your running time, right? If you're just an average person, what does that do for bending over, playing with your grandkids, or sitting for long periods of time and trying to concentrate in the office? But what we do know is that with chiropractic care, with some customized therapeutic exercise programs, and in some severe cases, PT if you need it, we can really get that SI joint functioning well, because what we see with SI joint dysfunction is that it usually affects, yes, directly the SI joint, but because that joint is so involved in general mobility and motion, sometimes we'll see compensatory changes in the low back, in the lumbar spine, in the front, in the hip joint, that happen as a result of this dysfunction. So we know how important it is when you're coming into the office to get a proper evaluation so that we can make sure that that is actually the root cause of your problem. And we typically do that through a careful consultation where we listen to your exact areas of concern. We do an exam so that we can see the function and mobility of that SI joint. And of course, if it's indicated, we'll take some spinal x-rays to actually visualize what that joint looks like on the inside to be able to determine if you have a misalignment in your pelvis that is creating all these issues over time. So we're able to have a targeted approach so that we understand that it is, yes, a problem in the SI joint, or there's a couple things going on, right? Your L5-S1, your low lumbar vertebra, it might not be functioning well as a result, or even a disc in your low spine can be referring pain off to the side. So it's why we do such a careful new patient process so that we can identify what exactly the cause of the problem is and treat it effectively. So if you're feeling any kind of pain sort of in the back, in that SI joint region, we'd be happy to take a look at you. This is just a little bit more about SI joint dysfunction. We look forward to seeing you on the next video. Take care.